Hey guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today is a special day because we have our lovely patient, Sarah, beautiful both inside and out, who's 44 years young. And today we're going to really kind of dive into Sarah's experience from the very beginning, researching our practice, all the way to the very end. We're actually not even at the end. So we're about 4.5, 5 months into Sarah's journey. Still continuing to have normal healing at 4.5 to 5 months, but we're going to really kind of get inside peek as to what Sarah's experience was. So first question is, how did you find us? What led you to come here as well?
Sure. As far as I recall, it was Google, but I
Yep.
looked very specifically into as many photos as I could, and I'm sure I did Reddits about how to pick a surgeon, and your Instagram feed was especially helpful. There were definitely like realistic women my age, and your website had those photos too. And so, yeah, that's how and you were extremely highly rated, and I would concur.
Okay, great. Glad we checked that box.
Yes, yes.
And during the consultation, obviously, you told me all of your specific concerns. I think the consultation is, in my opinion, it could be a vulnerable position for
Absolutely.
patients because you're sort of addressing some insecurities or things that are maybe just not making you as confident as you used to be. What was that like during the consult? Was that scary? Were you anxious? Was it, tell me what those
Well,
emotions were.
everyone in the office is super friendly, everyone on the phone. And then, yeah, you were patient, super in detailed. You had photos on the screen that we could address, specifically photos of me, where you could show specific things and what was really possible. You were very honest about what was really possible and what would be, make a good difference, a big difference. And so I really appreciated that. Yeah.
Perfect. Great. And if you can tell our audience, what were your main concerns? What did we address with the surgery?
Sure. I'm mostly like my jawline, jowls.
Hmm.
I was looking into lower neck and facelift, a little bit of under chin. You get the camera, looking down at the
Yeah.
camera, super non-flattering. And then also I had always had hooded eyes, but they were getting more and more hooded, so coming down to the outside of my eye.
Yep.
Yep.
Yep. And then finally, a little bit of volume loss in the face as
Oh
well.
yes,
Yep.
absolutely. I'm so sorry.
Yep.
Yes, I
Nope.
wanted a
All good.
little bit, yeah, of around my temples and just like right under my eyes. I wanted to do just a little bit of lift, and it's turned out beautifully.
Yeah.
Yep.
Great. Yeah.
Yep.
So I think Sarah's a good example of how when we do a facelift, is I, tell all my patients during the consult, we're not going to get any volumization with that procedure. We get, reposition, rejuvenation, putting the tissue back to where it used to be. But fat transfer can go above and beyond the results that we get with a facelift, even in the cheeks and under eye area, but especially in an area above the facelift in the temples, where they're very common place for folks to lose volume. So how would you say that the transformation has changed your confidence? Well, maybe let's take it back a step.
Sure.
First of all, we haven't even said it yet. Sarah underwent a deep plane neck lift, a deep plane lower facelift, fat transfers we just discussed to the temples, under eyes, and medial cheek area tapering out to the lateral cheek, and then finally an upper blepharoplasty. With respect to those areas, how would you say that it's kind of change, your confidence or just sort of just your daily approach?
I would say that the biggest difference for me was catching myself unexpectedly in a mirror or reflection. I feel like I look like myself again. I would catch myself and immediately need to like smile or change my facial expression. Like I feel like I look like a different, much older version of myself, and so that has just melted away. Kind of that insecurity. I just feel more confident and more like myself is the best way I can describe it.
That's awesome.
Yeah.
Yeah, cool. And let's go through your healing.
Okay.
Obviously, multiple stages, multiple phases of
Yes.
healing, and full
Sure.
transparency. Being completely candid. Tell us about the day of the surgery and how intense that was, that first week, and then just kind of going from there, if you don't mind.
Sure. My husband's biggest concern about the surgery was the anesthetic,
Hmm.
and the anesthesiologist called me the weekend before. It was just a couple of days before, and had all the information for me, his experience, how often he's worked with you,
Yep.
what kind of anesthetic it was, how it worked, and so that was super helpful for my husband in particular. He was very concerned about the anesthetic.
Yep.
And then the day of the surgery, we came in. everyone was so kind and so efficient, and made my husband feel so comfortable. Come in and talked to my husband. The anesthesiologist talked to my husband also.
Yeah.
And the surgery itself is like a minute, obviously. Like you lay down and then you're waking up. Yeah. But yeah, just got me into the car. We live a little ways away, so we stayed in a hotel. I was kind of feeling no pain that night. At the morning, started to feel a little bit more, but painkillers were adequate. And then you come back the next day and check everything out, and everything was fine. I will say it is major surgery, and maybe the first 3, 4, 5 days were probably a little worse than I was anticipating. It's not a joke. You are healing up, serious incisions on your face. But by like day 6 or 7, I was up and around. I was like making lunch for my daughter. It was significant improvement from that point on. And then that following week continuing on. And then my daughter's school started early, actually. So I was out and about at like 6 weeks, maybe a little bit even less. And I felt fine. I wore my hair down.
Right.
It wasn't super, I didn't look like this, but I looked acceptably normal. I don't think anyone noticed anything. So that was good. Yeah.
Yeah. And I think you're, realizing, what a lot of patients probably don't realize, that we try to communicate during the consult, but, sometimes it's not always the easiest thing to do, or we miss the boat there, but you're still healing.
Absolutely.
Right. And so, you can see on Sarah, still a little bit of pinkish hue on the upper eyelid incisions, which is a very common thing. Upper eyelid incisions can take a really long time to kind of fade into that invisible white line. We talked about one of the reasons why that happens. The eyelid just continues to beat when we blink and close our eyes against the eyebrow skin. So it's like chronic irritation, and an area where the skin can kind of get dry too, and that can exacerbate it. But, obviously you get past that acute healing, and you get into just, okay, these are minor things that I can cover up. But I think your point is excellent, which is that first week can be, really intense, especially with neck lifts, tightness on the throat, swallowing feels weird. It can be almost like an anxiety provoking experience, even more so than the pain.
Sure.
I don't know if that was your experience.
I was able to just take it really easy. I slept in my recliner, and so I wasn't too anxious. So I was grateful that my husband was great. So
Well, you're not a very anxious person, but someone that kind of already is at baseline, can be a very difficult thing that we try to coach our patients through, in terms of, hey, you're going to feel like your neck is tight, like a hand is going to be on there feeling, and just, making sure that our patients know that that's normal. So when they go home, they're not just questioning, oh my gosh, what went wrong?
Am I okay?
Right, exactly. What did you tell your family and friends, or did you just kind of let them find out on their own? Or
my friends, I had been talking about it since I was like 40, or maybe a little bit before. Like, there's only so much you can do with creams. Like, gravity happens. My mom still does not know. They came for my daughter's birthday, which was right around 2 months out. I don't know if maybe she's noticed and she's just not asking me.
Sure.
But I'm sure their eyesight are going. They're like 70 now. So, and I'm super grateful for that. You don't want to look like a different person.
Right.
You just want to look like a better version of yourself, like a slightly younger, more rejuvenated, less tired version of yourself. And so I have been very satisfied. Not having to tell my mom in particular.
That's great.
Yeah,
exactly. No, that's perfect, because what we talk about during the consult is we want you to, remain to be a recognizable version of yourself, but obviously a rejuvenated, well-rested, and some people even use the term more happy appearing.
Yes.
Right, which is kind of interesting, because, so many times we see two-dimensional photos of results, and that doesn't necessarily show off that kind of expression and the emotions and how someone can look happier.
Absolutely.
With this procedure. So, that's one thing that we talk about too. And, we don't want people to suspect that you've had surgery, but we want them to comment that, oh, something looks good.
Yes.
Right.
Yes. Yep.
And then finally, we want the results to last a long time.
Yes,
So,
exactly.
Yeah.
Yes.
Well, that's great. Thank you for, being very candid and, vulnerable, as I said, during the whole experience of the consult, but then also doing this interview.
Sure.
And telling us the truth and your perspective on how everything actually goes down.
Yeah, it's been a wonderful experience. Yeah.
Awesome. Well, I hope you enjoyed today's content. Be sure to like our video and subscribe to our channel.